So, good afternoon. My name is Heather Henry. I'm your host on this discussion. I'm a practicing public health nurse from Sale, and I'm also an honorary senior lecturer at the University of Salford, which I think is probably my title for today. I work in the third sector as a social entrepreneur and a trustee in the third sector. And I'm also a Queen's nurse because I know that there are a few Queen's nurses joining us today. And the purpose of our 90-minute discussion is to talk about the idea, scope and feasibility of starting an academic network to introduce health creation into the undergraduate curriculum. And I sent a bit of pre-meeting information to you in the form of the webinars from the health creation book that Nigel's just published. I'll tell you a bit about that in a bit. And also the manifesto for health creation that was written by NHS Alliance, now Health Creating Alliance, CIC, which I chaired for a couple of years. Now, this meeting's being recorded, so just to let you know that, and we'll be sending the recording out to people after the meeting. And we thought that it was going to be a small meeting of just a few people, but actually over 70 of you have registered. So we kindly, Salus, who are the publishers of Nigel Crisp's book, have kindly offered to host our webinar. So thank you to Laura and Mark for hosting us. And today I'm joined by my two colleagues at the University of Salford, who I'll introduce in a moment, and by Nigel Crisp. And they're going to set the scene before we go into a discussion and gauge the interest about this idea of an academic network. Now, Nigel will start and he'll talk about his work around health creation, and he calls for us to take off our NHS spectacles. And Nigel recently published a book. It's called Health is Made at Home, Hospitals Are for Repairs, Building a Healthy and Health Creating Society. And I would recommend the book, and there are lots of different case studies within it of health creation, both in health and care, and around the wider social determinants of health, things like education. And he's going to be talking to us and giving a range of examples. The book gives a range of examples, and he'll be talking to us about his work. Nigel's staying till about 4:20, so I'm hoping he'll take questions after his presentation, and he'll be around for a little while after that. Jackie and Michelle, my colleagues from the University of Salford, will talk about developing the Future Nurse curriculum at the University of Salford. Then we're going to gauge from you how far you're along with the idea of health creation in undergraduate curricula before discussing whether a network is feasible and start to think about what it might look like if it is. And by the end of the meeting, I'm hoping we'll have some clear action points for us to take away. So in terms of how we're going to use the webinar, please do introduce yourselves using the chat function. You'll be able to find the chat function at the bottom of your screen. And if you do want to speak, then there will be a Q&A function. So do send us in your questions and I will read them out. I won't read them out. I'll probably invite you onto the panel to speak. You'll be given the microphone and you'll be able to speak and put your questions. But otherwise, you can, of course, raise your hand or just put comments in the chat function. And if you want to save the chat, there are 3 little dots. So you can click on those dots at the end of the meeting and you can save the chat if you wish to do so. I know we've got people from higher education, but we've also got people interested from policy, strategy, student nursing, practitioners like myself, and members of the community, and a representation not just from health and care, but around the wider determinants of health as well, like housing. And you're all very welcome. And of course, you bring with you a wealth of expertise. I know some of the people who've registered, and it is huge. The health creation or solutiongenesis, it's not new. Not only Nigel and the Alliance, but other people like Sir Harry Burns, the former Chief Medical Officer for Scotland, have talked an awful lot about health creation in medicine, for example, and for years. And it's been part of the curricula for years, but sometimes it's been a bit squeezed out, and we've ended up downstream firefighting and talking about the more sexy doctors, drugs and kit. But I know that in the midst of all this, we've got a handful of universities who are actively promoting it in the curriculum. I've got one here who can't make it today, who's telling me that our pre-registration, now master's level curriculum, has moved away completely from anything that might resemble biomedical illness model, but know from the regulator that we are considered to be unusual. So thank you for that comment. And the pandemic, I think, is highlighting even more actions that have made us think about understanding the causes of wellness, things like social contact, rather than just the actions to prevent and manage illness. And I thought, well, with a few others in this discussion and in the participants, that we might think that it's the right time to have this discussion as we prepare our future health and care professionals for a post-pandemic world. So now I'd like to introduce Nigel. Lord Nigel Crisp is an independent crossbencher in the House of Lords, where he chairs the all-party parliamentary group on global health. He co-chairs Nursing Now, the global campaign for nursing and midwifery. He was the chief executive of the NHS in England between 2000 and 2006, and now writes extensively on global health with a focus on Africa. And his current main interests are global health partnerships, health creation, and thank you for this, Nigel, nursing. And he tweets at Lord Nigel Crisp. So Nigel, over to you.
Great, thank you very much indeed, Heather, and congratulations for getting this meeting together. Which is, I think, indeed very important. And of course, you are one of the great health creators, the great pioneers of health creation. I actually refer to Heather in the book, and you have you have enormous experience, I think, of health creation. So it's great you're leading this discussion. Also, you're very right to highlight COVID. I mean, we're all deeply affected by it, and let me, as a non-nurse, non-clinician, just pay a tribute at the beginning to the health workers around not just the UK, but around the country, to whom we owe so much. And it's in the context of people, I think, being pretty worn out and tired at this stage of the pandemic. But what a remarkable thing that people have been doing. But we need to think about the future as well. And one of the things when I think about the future that I've been aware of for some time, having been in and around health for about 30 years, I guess, is that what happens in health is what happens in the heads of the practitioners and the clinicians. How you think and see the world is fantastically influential. And therefore, those of you who are the educators around this meeting have this extraordinary role to implant those ideas early, so that how people will see the world will be how you're helping them to see it today. So I do think it's really important to make the links that Heather is making between health creation and the academic curricula and the academic network. So I do wish this entire enterprise very well. Let me talk a little bit about the big ideas in my book. So first of all, could I have the slides, please, Laura? And while these are coming up, could we, no, we're obvious, there we are. Health is, but so the book is called Health is Made at Home, Hospitals for Repairs. And actually, just as a matter of interest, that title came from a friend of mine, Francis O'Maswa, who's a great African health leader. And it's interesting, isn't it? It's not just about this idea that maybe we need to do more in the community. It's actually about the idea that we can make health, we can create health. And that's what this is all about. It's about the causes of health and not just the causes of illness. Let me have the next slide, please. So I say what you need to do. And I worked for the NHS for a number of years, and I spent something like the last 15 working a lot in Africa, and have seen things in very different contexts and very different ways. And in that places, I've learned to take off my NHS spectacles. I've learned to see the world differently. And I think that's what we need to do at this stage, to think about health differently, to see the world differently. And this book started off as a celebration of the health creators. I started it before COVID. I think it contains about 60 stories about people who are creating health all around the UK. But of course, COVID made it much more relevant, as Heather has already said, because COVID, I think, has shown us, hasn't it, that there are vital roles in health for the NHS, of course, for government, in setting the direction and managing the environment and so on, and of course for the general public as well, because how we've all behaved determines to a large extent how fast this epidemic, this pandemic has spread. But actually, when we look at the future, we know that the NHS can't do everything by itself in health, and never, of course, has been able to. But if you think about so many of the things that lead to the problems that people deal with, whether they're obesity, whether they're addictions, whether they're stress caused at work, perhaps, or whether indeed they're things associated with poverty, all those social determinants, as Heather's already said. The NHS can do the repairs, but it can't tackle the causes. But other people can. And amongst the people who can are, of course, government, who have enormous responsibility in this area, but so do employers, so do schools, so do families, so do communities. And it's those people whom I'm referring to here as the health creators. And I'm going to say a lot more about them. Next slide, please. So amongst the health creators, they are introducing new ideas. Now, actually, Heather is quite right. A lot of these ideas are based on history and are based on things that people have known about for many years. I will come back to that point. But they're sort of trying to bring them more closely into the way we think about health, and with a greater focus on quality of life. There is one trust in the UK that I know of that has actually changed its vision and its purpose. So it is now about improving the quality of life of its local, of the people who use it. So not just about health, but about quality of life, much more holistic view. The health creation is not about things like social prescribing and people in the NHS going out and engaging the public on our terms. Social prescribing is great, but it has a particular role. What we're talking about with health creation is people who are taking control for themselves, who are doing things for themselves, sometimes without health professionals, and I'll give you examples of this. But the key point here, this is not business as usual. It's not we as health professionals and managers deciding what's best for people and going out and getting you engaged in our plans. This is about other people taking control. Next slide, please. And it's worth remembering the World Health Organization's definition of health. Health is about physical, mental, and social well-being, and they go on, and not just the absence of disease and injury. Well, the NHS and every other health system has concentrated heavily on the physical. We've got better at the mental. In the UK in particular, we now have policy of parity of esteem, even if it's not yet fully in practice. But we've done very little about social well-being. And this is part of what we now need to be thinking much more about, and it's much more the territory of health creation is all of these things, but perhaps particularly social well-being. Because if we think of health and well-being, and if I can have the next slide, please. Health and well-being in sort of human terms are about life and freedom, confidence, the quality of our lives, but they're about social things, they're about our relationships, they're about how we live, what happens to us at work and at school, all those connections and relationships and activities. It's about being all that we can be and living life to the full. So creating health for me, and next slide please, is very much about providing the conditions in which people can be healthy and helping them to be so. And my paradigm for that is what a parent does for their child, what a good teacher does, what a good school, what a good community does. They're all about helping create resilient, confident, capable, and healthy individuals. And there are examples of people doing these things around our society everywhere you look. We just don't think about them to some extent. And in my book, I was very conscious that I wasn't inventing anything. I'm not creating anything here. I'm pointing at something that's happening. People are doing these things, and by pointing at it, I'm seeking to accelerate it. And one of the things that Heather is doing in this webinar, of course, is seeking to accelerate it by getting this into the mainstream of academia. Next slide, please. All of this fits into a wider tradition, which I've labeled as human flourishing, because there's history and there's science here. And for those of you who are academics, you'll like both the history and the science, of course, because that's where you come from. Important point is this is about the causes of health, not the causes of ill health. And very often when people talk about the social determinants of health, it's all the negatives, isn't it? It's how people are damaged by the way our society is structured and so on. But turn that on its head. Think about how all those things in society, like your education, your friends, your relationships and the environment, how they cause health. What are the causes of health? And there's great history here. The salutogenesis, which goes back a number of years and has been written about quite extensively. But it goes back 2,500 years to Plato and Aristotle, who talked about something called eudaimonia, which is normally translated as human flourishing. And it's about living well. And it's really interesting background to some of what we're talking about. So this is not new in the history, in the human tradition, but there's new science. There's new science about how greenery affects you physiologically, changes you physiologically and changes your mood, about what relationships do and how they can impact on your resistance to illness, apart from anything else, but also on your recovery, but also on your general health. And also, of course, good science about exercise. And we're going to see more of that science coming. So there's history and science behind all of this. And that's now why when I think of health, next slide, please, I think of it in three chunks: health services and health care, led, of course, in our country by the National Health Service and the professionals. Prevention and protection, another really important slice of activity, which is led and should be led very largely by government, although everyone has a role. And then health creation, which frankly is led by everyone. Employers, think about how much employers can enhance one's life as opposed to occasionally damaging it, or perhaps often damaging life if one's not careful. So thinking about those three things, they all overlap to some extent, but we don't pay much attention at all to health creation. I think as we go forward, we need to do so. So who are the health creators? The next slide, please. And then indeed the next slide. Here are just a few of them. I'm just going to run through these terribly quickly, Heather, just to pick up 5 very different examples. City Mental Health Alliance. This is the big companies in the City of London who've decided that they want to create a healthy environment. And that's not about gyms and relaxation rooms. It's actually about how can they reduce stress? How can they make this a great place to work? How can they change business processes? The TR14ers down in Cornwall, a policeman who 15 years ago was fed up with chasing kids for vandalism or for minor crimes and started working with them instead. And with the help of Hazel Stootley, who's on this call, I notice, set up a dance club, which is still going 15 years later. 2,000 kids have been through it, young people have been through it over the period. They run it themselves. And they have the Exeter University research on it has shown us how much this has improved health. Incredible Edible, people up in the north of England, near Leeds, group of women who started to grow vegetables in public spaces, and as a result have started to build community, had community feasts and so on. This now happens in 150 communities around the country. The sewing rooms in Skelmersdale, which is a woman who set up a social business with the aim of sewing to provide local jobs, but also to bring people together, and has brought people together very impressively. Or Vertical Future, something completely different, private sector company that is growing farms, growing food in redundant buildings, essentially, although obviously hygienic, organized in a hygienic way, but growing food very locally in towns and elsewhere. Now, all of these people are creating health. And let me just flip on to the next slide very quickly. People are creating health everywhere. Some of them with support from health workers and health professionals, some of them not. But all of them have some things in common. And this is the slide that I think I will end on, which is the next slide, please. The 10 behaviors that I identified in the book are the ones that you can see here. And let me mention 4 of them, which I think are particularly important. Third one down on the side, left-hand side, this is all about relationships. The health creators start by working with people. They build relationships with people. It's not about systems. There's a saying in management that culture always trumps strategy. And actually, the reality is relationships trump systems. You need systems, you need good strategy, but actually build relationships and then build your program or build your activity. A second really important point that I would want to bring out here is at the top on the right-hand side, which is meaning and purpose. People are doing things which have a meaning and purpose for them. They're not just some management objectives. They're not delivering a plan. Further down on the right-hand side, there's a bit about being entrepreneurial and learning by doing. All these health creators are purpose-led and vision-led, not plan-led. If they're going in this direction because that's where they think they need to go and they have to change slightly to hit their purpose, then they do it. They learn by doing. But the final point, and the one that I know Heather will stress in all of this, is taking control. How do they actually take control in terms of doing things for themselves? Yes, asking the professionals for support in many cases, or to work with them. But that's the real challenge, I think, for the professionals. And one of the things that will have to be worked through as you develop curricula around these things is what's the professional's role? And I'm going to end with a quotation from Heather, which is, you know, as a nurse, I used to inject medicines. Now I seek to inject confidence. That's a very different role, but I think it's a real example of the sort of thinking that people need to do when they're thinking about health creation. So thank you for that. I'll stop there, but I hope that's thrown out some ideas that we can discuss.
Thank you very much, Nigel. So this is an opportunity now to ask Nigel any questions that might arise from that. I think that was a fairly comprehensive overview of your work so far. Are there any questions? And thank you for your comments in the chat. I can see that we have a very experienced audience there. Do put your hand up or put a question in the Q&A. Haven't seen anything. We'll come back to that then if there's any questions. Okay. What I'd like to do now is to move on to the presentation on, just to give you an example of one university at the University of Salford and their progress on funded future nursing care, and to introduce you to Jackie and Michelle, my colleagues. Dr. Jacqueline Lee is Professor of Nurse Education Practice at the University of Salford. She co-chairs the Personalised Care Interprofessional Education Framework, and she's a National Teaching Fellow and Principal Fellow of the Higher Education Academy. And she's is it the chair or the deputy chair of Health Watch, Jackie?
I'm the deputy chair of Health Watch.
Deputy chair of Health Watch, yeah. And you tweet at Jackie A. Lee, L-E-I-G-H. And with Jackie is Dr. Michelle Howarth. She's a senior lecturer in nursing at the University of Salford and deputy director for postgraduate research. And Michelle has a special interest in social prescribing and uses nature-based, person-centered approaches to promote health and well-being. And Michelle leads the National Social Prescribing Network Special Interest Group for Nursing, through which she's been actively campaigning to raise awareness of social prescribing amongst nurses through research, curriculum development and placement opportunities. And Michelle tweets at Howarth #2L. That's right, isn't it? Okay. I'm Heather Henry 4 if anybody's interested in tweeting about this meeting. Okay, over to you, Michelle and Jackie.
Hi, thanks very much. Thanks for the introductions, Heather, and thank you, Nigel. I think that was an absolutely fascinating presentation, and I'm going to draw on some of your comments and words actually through this presentation as well. So we've got 10 minutes for a whistle-stop tour of what's happening, and we sort of entitled this "Realising the Art of the Possible," and how you promote health creation through social prescribing, but particularly through the personalised care approaches that sort of evokes. Jackie's got complete control of the slides, so I shall say next slide, please, Jackie. Thanks. So personalised care, the concept of it has really promoted opportunities for us to think very differently and creatively about what matters to an individual rather than what's the matter with them. It helps to remove our NHS specs. I really do think it helps to put the person centre to what we're doing. To some degree, social prescribing acts as a conduit. It follows a process. It uses a process of referral from a frontline person to a link worker. The link worker has that wonderful wellbeing conversation with that individual and refers to a community asset. And of course, they've asset mapped the entire community. They know what's out there, and they are brilliant advocates of personalised approaches. And we know there's lots of different models out there. Richard Kimberley's written extensively about this, and there's lots of different processes. But what's really, really important is the fact that we need to recognise the brilliant work of these community assets that are on our doorstep, and the fact that they are actually actively creating health all the time. So the examples that Nigel provided, you know, the incredible education, you know, reducing social isolation through growing vegetables together, the knitter natter groups, all of those wonderful, often small organisational led assets that are out in the community that help support people, help to create wealth, help to keep people healthy and well-being. And I think COVID is, for all its bad press, has actually shone a fantastic light on that work and really illustrated the way in which communities have stepped up to the plate to support individuals, to help reduce their isolation, to help support those individuals through this terrible time. So where do our students fit with this? Well, I've been a lecturer for 20 years, along with Jackie. We started at the same time at the University of Salford, so we've been lecturers for a long time. And prior to that, we were both nurses and very proud to still be nurses. But, you know, to be honest, we still teach our nurses to fix people. We still don't really get them to think about health creation. And I know the new NMC standards, well, not so new anymore, do have that slight revisioning of personalised care and rethinking of how we get our students to think differently. But we do insist on sending them out to NHS placements. We do insist on sending them to areas that they might not get the opportunities for learning. And we need to look about, you know, what's out there. So Jackie, if you put the next slide up for me. This is just a tip of the iceberg in terms of Greater Manchester and some mapping that we did a couple of years ago. And you probably won't be able to read all of that. But there's probably well over 15,000 organisations just in Greater Manchester alone, working in the VCSE, the voluntary sector, the community and social enterprise sector, providing lots of opportunities for individuals to engage, to connect, to develop and grow as a community. And I think that our nurses and other professionals need to be exposed to this to truly understand how we create health, and so that we're opening them up to the fact that you can't, it's not just about fixing people, it's not just about the health, it's how we create that in the first instance. Next slide please, Jackie. Okay, so how? So this is about engaging our students. How do we build in those salutogenic principles? How do we talk about, you know, pathogenic is good and we do need to be able to have those skills, but how do we also recreate a balance where we've got those salutogenic principles, thinking, okay, what about well-being? How do we promote health creation to make that difference? And that's all about realising the art of the possible and enabling our students to take off the same NHS specs that Nigel was talking about earlier. We've been doing quite a lot of work at Salford to enable this to happen, and I think at this point I hand over to Jackie to talk a little bit more about what we've been doing.
Thanks Michelle. So really it's just building on the discussions and the presentations that we've had so far, and I suppose it's thinking about how do we operationalise the key concepts that Nigel's talking about when we look at the map that Michelle's talked about from a Salford perspective, looking at obviously those opportunities is the tip of the iceberg. So what we have really is we have or professional body requirements, for example, the Nursing Midwifery Council or the HCPC, who are quite prescriptive really in terms of standards of education and development for example, undergraduate students. So, for example, in 2018, the NMC brought out a number of standards relating to the professionalising nursing, which offered an opportunity really to think differently about how we think differently about our future nursing workforce. And it allowed us to think a little bit differently with our curriculum. So what you have on screen here is some of the key concepts within the future nurse curriculum at the University of Salford. And for example, there are core concepts that run through the programme, for example, leading and managing nursing care and working in collaborative teams, promoting health, preventing ill health. Some of these concepts you'll think about some of the behaviours around health creation. But what we've always found, and I suppose that traditionally, and we have had that biomedical model, the way that we think about our future workforce, it provided an opportunity really to think differently and to think differently about where students learn in practice. Traditionally, students have always engaged within an NHS practice learning environment. So there is an opportunity, if we are thinking now about social prescribing, personalised care, health creation, then that needs to map to our curriculum. We need to, our students need to think differently, and our academics need to think differently. So that means exposing them to thinking and different practices and practice learning experiences in different settings that link to, for example, the credible edibles and men's sheds and your knit and natter. And academics do have that responsibility to demonstrate to the NMC, demonstrate to the university that obviously the students at the end of their programme are fit for practice. So we do really need to think differently and challenge the existing pathogenic practice learning and placement models. And it was great, Heather, it'd be useful to connect with the university that's completely changed their curriculum. So, and that would be absolutely fascinating. But today, I suppose, for us, it's about you, the audience, the participants, and those who have some questions later, just to think about how can you think differently? How can we shape our curricula so that our students at the end of their programme do experience and do think about nursing practice or physio practice very differently, seeing, for example, the community as an asset and actually having some placement learning where the placement takes place actually see students as an asset as well. So that's not going to happen by chance. That needs an absolutely rethinking and completely changing mindsets. So, for example, at Salford, just one way that we've actually done this is by employing a practice learning facilitator who will work in those different practice learning environments, who will be networking and engaging with stakeholders that maybe we haven't really engaged with before. So they're talking about the students, they're talking about interprofessional learning, they're thinking about interprofessional practice. And in fact, this is Maxine. So Maxine Hamilton-Bell is the person who we have in place for, at the moment, a 2-year contract. And Maxine's looking at some of the barriers to thinking differently about practice learning experiences, but overcoming those barriers as well. And that's through building those relationships, really thinking differently and changing mindsets. And what she is doing is creating different student pathways, learning pathways, right from students, introducing students at the first part of the programme. So we're not just talking about NHS. You know, students at the moment, especially those students who have just joined us at January 21 students, you know, they've seen what's happening with the pandemic. They've probably engaged with communities. There's lots of work going on in the communities just to keep communities going. They are resilient. communities quite often, particularly in Salford, they're very resilient. So it's actually, I would expect, if I was a student nurse, for example, coming onto a programme, that I would expect to see a programme that would build on those community assets. So I wouldn't just be expecting a programme that particularly looked at an NHS-driven curriculum as an example. So Maxine is developing learning pathways for students, thinking very differently and engaging with programme leaders and our directors in the university, again trying to change mindsets. What's really important as well is that as part of Michelle talked about leading the National Social Prescribing Network. From that network, we've had a task and finish group, and what we've actually developed is what we call is a Percy framework. So it's an education framework that's been developed with 7 universities nationally, with lots of different organisations, with our students, and we called it Percy because it's got a very long title. It's actually called a Personalised Care Interprofessional Education Framework, Social Prescribing Placement Curriculum Document. So it's got a huge title. But what we see it as almost a sort of a blueprint. It's a guide that different HEIs can actually have a look at, pick up, and actually think about actually how they could actually promote promoting health creation, social prescribing, a very personalised curricula, thinking very differently. So we've developed this framework. We're about to test it, and it has particular areas. It has 4 elements. For example, we have a clear purpose of what the framework would look like, how we've developed it, what's our vision, how universities could actually pick it up and operationalise to support student learning. So it offers very general ideas and considerations, for example, around students' practice learning opportunities. So it can be embedded into a curricula without a university having to go through terrible revalidations or major amendments with their university just because they want to make some changes to a programme. So for example, just as an example, just to give you a little bit of food for thought, when thinking about students' practice learning, I'm trying to move away from the word of placements. Placement is just a physical entity where the student is placed. We want to think about practice learning experiences. And I think I quite liked Nigel's 10 behaviours, and you could think about those when we're thinking about actually where we could place our students, where their practice learning could be. You know, and we can use a scope and a spoke and a co-production model, for example, and again where the students can work with their academics to really think about where those practice learning experiences could take place. And the co-production is really important because it is learners working with local groups and organisations, for example, to deliver a project. Now, how fantastic would that be for students who are in the final part of their programme, where they're learning, they're transitioning from a student to a registered practitioner? How ready will they be because they're engaging in a real life project? And we think that this is maybe the way forward, how we can start actually unpicking and embedding health creation, social prescribing within a curricula. As part of Greater Manchester as well, we're really fortunate because Health Education England are funding projects that we call enabling effective learning environments. And that's just making sure that we have the best learning environment for our multi-professional students. We're looking at capacity for students, and actually COVID, what that's happened, it's actually reduced capacity in hospitals for our students. So we've had to look differently. So actually it's quite interesting that sometimes we have to look differently because there's a critical, it's almost a perfect storm. So at the moment we're needing to think differently, which is fabulous for people like myself and Heather and Michelle, who are absolute advocates of students learning differently anyway in different practice settings. So, but for Greater Manchester, the future workforce that supplies a key strategic priority. So we've actually at the University of Salford, we have a project at the moment that links to this enabling effective learning environments, where we're able to think about how we seek these new practice learning opportunities, and how do we develop the educators out in practice and in higher education to make sure that the learners are placed within communities, so they are seen as an asset, the community is seen as an asset, and it can support that and promote that health creation. And I think actually we've got Elaine's online, and we've actually employed somebody called Elaine Smithies as a research fellow, and she's working with, who I talked about before, who's Maxine, who's also a practice learning facilitator. And what Elaine and Maxine are both doing is the thinking, and they're out there, they're building those relationships with those community assets, with those health creators, to think differently about practice learning. So Elaine develops the networks, she finds the people, and then Maxine almost goes in behind and starts developing that practice learning environment, has to work out how do we supervise, how do we assess students in those practice areas, how do we meet professional regulation. And this is a model that's actually working really, really well. It's something that, again, panel members, the participants may want to consider. What we want you to do today is think about, you know, how are you going to create those opportunities? We're also really thinking about creating an academic network around health creation as well. That's something maybe that Heather will be talking about later, and we were thinking that Salford could host that. So I think from my perspective, I suppose that where we're coming from the University of Salford is building those relationships and networks with those key organisations to think differently about practice learning, and there's the type of health professional that we're developing in the future that does think about health creation and isn't a NHS illness focused nurse or physio or occupational therapist at the end of their programme. That won't happen by chance. So it does need that change of mindset from academics and practice. Thank you. Over to you, Heather.
Thanks very much indeed. Yes. So first of all, any questions for Michelle and Jackie? Do stick your hand up. I think we've got quite a lot of comments and thoughts and quite a few questions now. Okay, so let's go on to the questions. So I'm just going into the questions first, and then I'll get on to a few points that's come up in the chat. Ian's asking around working with travellers and children and families in disadvantage. Ian, do you want to come on and talk about that? Can we put him on mic? And he says, do you have advice on health creation with travellers and children and families in disadvantage? I can think of one example, but we'll see what we come up with.
Over to you, Heather, if you have an example.
Go for it, Ian.
Yeah, hi Heather. I've met you a few times, Health Foundation, Oxford, HSN, patient safety, etc. So in Plymouth, I have quite large traveller communities, and we're trying to engage those large Chinese immigrant families around sort of Falmouth. And it's really how we sort of work with them and sort of build with them, and also sort of children and families in disadvantage. And so it's about health equity. It's about how, as nurses and professionals in the curriculum, we actually engage, but also collaborate and come up with sort of joint solutions and joint working. Any advice? Helpful.
Any of the panel want to speak before I talk about Leeds?
I would say that it quite often there might be, for example, teams out there who already link with those communities or those transient communities. And quite often it's, for example, Elaine's role, who I've just talked about, who's the project Greater Manchester. It's building those networks, it's seeking who those people are who might be supporting those communities at the moment. Is that Nigel? Have you putting your hand up?
I wasn't trying to interrupt.
No, go on.
But I would like to say something. Yeah.
Yeah, go on, carry on. Do you want to carry on?
Well, no, you finish what you were saying, and then I'll come in.
So I think it's almost building with those relationships that we already have. And I would say it'd be really good to speak to you about the Percy framework that we've developed, to see whether there's any models there that we can that would support that networking and those building relationships and co-production with those communities.
Nigel?
Great. I think this is a really interesting point that you produce for us, Ian, that makes us think. One of the things that I've noticed in the chat is people are talking as if this is about the third sector. It's not about the third sector. I mean, the third sector is fantastically important, but the biggest influences on health are your job, your education, your housing. Now, in Romany families, that may be different, but so I think there's something here about people understanding that those are the big influences, and that some of the things that we need to do when we're working with disadvantaged groups is how do we get those other people on board? There's somebody here from a housing association, yes, and so on. I mean, fantastically important. How do you get them on board? So it's not a health problem. There's a bit here about how the police are behaving, of course, and so on, isn't it? So health creators can come in all kinds of different forms, and we really must remember the private sector. The examples I gave, two of them were private sector, the city and so on, and one was the police and so on. And I think we've got to really think our way outwards and openwards into who are our allies. And then just the final point I'll just make is that there's a sort of approach that people take about joining the dots. You know, if you're working in a particular town, who are the key movers and shakers? Doesn't matter what their job description is. If the senior police woman is great, get her on board. If the senior police woman is awful, well, maybe ignore her and go for the principal of the local college. Do you know what I mean? There's a bit here about joining the dots and getting people together. And I think that becomes part of your role if you as nurses or others are working in the community, is to be thinking about that, and also thinking about the local power structures, as Chris Dabbs again has said in this, as well as the more therapeutic model, as it were. Anyway, that's my contribution. Thank you.
Just very briefly before I invite Matthew in, I think we can, if we try and get Matthew on the panel, and then he can talk about his thoughts about housing, because I agree with you, Nigel. The standout work for me is the work of, there's two big organisations that work with travellers. That I know that when I was at the Alliance, we worked with them. The first is the Family and Friends of Travellers organisation, which is based around down south, and the other one is Leeds Gate, which stands for Gypsy and Traveller Exchange. And they have been working in equal partnership with the NHS for some considerable while because of the number of travellers that are in that area. And the significant piece of work that you may be interested in with Leeds Gate is something called Bridges, Roads and Tunnels. And it is the work of the travellers alongside the NHS in terms of literally having to find different ways to be able to be well. You know, jumping over people in the case of Bridges, where there's a clear road to something and where they actually have to tunnel. They'll describe it much better than me, and there is documentation. But there's a specific nurse who's a Queen's nurse who has been working alongside the community as an equal partner directly with the travellers. I mean, this is award-winning stuff. They've won several awards for that, so you could certainly look at that. Matthew, you made the point about the involvement of housing and what housing have been doing, which I truly champion. Do you want to say a little bit about that?
Yeah, happy to. Thank you, Heather. Yeah, I suppose it's from our point of view, we obviously house probably 1 in 4 people across the UK. So we, as Nigel's kind of highlighted, we are a major health creator, but we also invest in our communities through various different community investment kind of models. So I work for Sovereign Housing Group as communities director, and we've been taking an asset-based approach for a number of years. And part of that, and I get your point, Nigel, around it's not about the third sector, but we have been trying to enable and provide kind of platforms for the third sector to kind of thrive over quite a period of austerity around public service as well. So I think there's a number of things that we could do. We could be placements. We could help with some of your thinking. You could help with some of our thinking around how we operate. So we have, you know, lots of different frontline roles through repairs, housing, community investment, and the NHS and care do as well. And actually what we probably haven't done is at a strategic level kind of banged our heads together and said, how can we do this differently, better? And then there is also a kind of groundswell of mutual aid and volunteer organisations that you've kind of highlighted, and for us it's about how do we build that ecosystem and enable it to thrive. So we do have, I've worked with HACT, the Housing Associations Charitable Trust, whom again we have a kind of cohort of housing associations that cover about 50% of them that would be really glad to have an opportunity to speak to you about how we could possibly partner or do things differently. We're regenerating estates, we're rebuilding, we're investing millions in kind of sustainability and asset management. Those areas that we're regenerating will be the hardest hit by COVID, will be the most deprived, and will have the most economically challenged, as you've kind of described. So yeah, really keen to look at how we do that. I think, again, social prescribing, we've not engaged with to a level whereby we kind of enhance the circular economy, and that's something that we could do as well. So yeah, really pleased to hear some of your thoughts and suggestions as well.
Thank you very much. I think in terms of my, I barely call it clinical practice because I'm working with the community directly so much. Housing is usually one of the first to come forward, as is Faith, and I know that we've got several parish nurses on this webinar, so if you do want to speak, do indicate that, and we can get you on the panel. And I don't know if anybody's here from education, because a lot of it is about schools and our relationship with schools, especially right now because of the what's happening to both the children and the staff in schools, which will take us a very long time to get over. I'm going to go to the next question. Pam, we've been corresponding quite a lot. It's good to meet you. If we could get Pam on the panel, and Pam has got experience from France in terms of looking at these issues. So I don't know whether you want to comment or ask a question. And you're on mute at the moment.
Yeah, I lost connection as I was transferred between one part and the other.
Nice to meet you.
Hello.
So what's your experience? I know you're from Liverpool, John Moores.
Yeah, I'm at Liverpool John Moores now in adult nursing. I was in France for 25 years and in nursing education for 7 of those years before I moved back to the UK last November, just before November 2019. And in France, they were rolling out what they were calling service sanitaire, which is 105 hours of health promotion in the community for all medical and allied health students. So that included physiotherapists, occupational therapists, and the idea was to get them working in teams and to be working with communities on health promotion. And in our area, we'd already started in this respect. So we were working with the local municipality to put in place health promotion with using our students as resources, but giving them this learning experience, which they were working with things like France Alzheimer's, they were working with France Parkinson, they were working with the local luncheon club, and generally working with elderly people, because that was the biggest population that we were trying to influence the students' vision of. Because we'd done health promotion in schools, but it wasn't actually impacting our adult nurses' vision of health promotion in acute care. But it was interesting the way the French were rolling out on a nationwide project. And my question is, can we think that maybe that could be the future here, of getting some sort of civic service into that undergraduate training so that students are exposed to this? And we've already got those ideas of civic universities with links to local assets in the community, and how can we join those dots together? So Manchester's got this huge project of getting students out into the community, into homeless shelters and everything else, but how can we tap that not just as an add-on experience, but as part of the actual undergraduate experience for student nurses? And I think the biggest problem is getting the academics on board, and also selling nursing as something different, because we're selling it as technical skills. We're not selling it as something that is much broader.
Yeah, thank you. I could see a couple of nods there, so I don't know whether Jackie or Nigel want to talk to that.
I was going to say, I'm happy to respond to that. I can't agree with you more, Pamela, actually. I think there is a need for a mindset in the way in which our students come to us, in how we sell nursing. I was talking earlier about, it's not just about creating clinical skills to fix people, it's about understanding the wider needs of our communities, and us being ambassadors, and students being ambassadors, and whether there is the opportunity to develop that sort of more civic responsibility in the curriculum, when we've got a jam-packed curriculum that is very led by professional regulatory body that I think takes a bit of convincing with some things. I think, you know, we have to be able, the sectors out there need to be able to see our students as assets, and B, we need to be able to engage with our students very early on to say, this isn't just about fixing people, this is about a whole range of other things. And C, I think once we've got those two steps in place, we can then think about more about the civic responsibility within our curriculums, which I think has been a little bit overlooked. So I can't agree with you more, Pamela, and I've not got any answers to how we do it, other than this is a great start today.
May I come in very briefly, Heather, and then I'm afraid I do have to go. I think that was great, and I think that's absolutely right. You make a terribly important point, don't you, about the role of local authorities. You know, that local authorities can play a huge role, and I suspect one wants a local authority rollout of this in a way rather than a national one, perhaps. And you've got some terrific allies in an organisation called New Local, which used to be the New Local Government New Local Government Alliance, I think, and I think they talk about the community paradigm, and it really is about, you know, how do we return, it's about power to some extent, and decentralization, how you return some power locally. And I would have thought something like this, wouldn't it be fantastic if a nursing school were talking to the local council about how they could do this, and that the placements you were talking about weren't just in the third sector. The third sector is part of this, really important, but could be in housing, could be in private industry, could be in social industry. You know, private industry is the place which creates as many problems as it solves, if I can put that in health terms, doesn't it, in terms of stress and so on. So I think there's a lot of allies and people to be thinking about there. Let me leave you with one final thing. If you're really trying to make a big change here, it's worth being really quite bold about it. You know, you're not trying to make a marginal change. You're not trying to persuade the people, the guardians of the curriculum, to shift, 5 degrees. You're actually wanting them to shift 50 degrees, aren't you? Or 90 degrees or whatever, I don't know. So I think you need some quite radical ideas. And I think, some of what you were just talking about might fit into that. Let me leave you with one from Africa. Côte d'Ivoire, they want their medical students, who are mostly middle class and from the towns, to understand the poor people. They don't just send them into the countryside to visit people. They make them live in the poor areas of town, or in the poor area, or in the villages. Now, we're not going to do that, I guess, but it was quite interesting. They live the same life as the people they're looking after, and it really made it a very distinctive medical school there. Anyway, I must go, but I very much look forward to supporting you in any way I can, Heather, with moving this on, because I think this is really important.
Well, I think yourself and is it Baroness Watkins, particularly as a nurse within the House of Lords, I think we do need your help to influence the regulators. There's quite a few comments there about the regulators and how far we can push them in terms of developing curricula. And I think we would rely on yourselves and the networks that you have within APPG and etc. to help us with that. Thank you so much, Nigel, for coming.
No, great. Thank you very much.
I'll see you again, no doubt. Thanks. Just to follow on from that, I would agree with Nigel that new local, in fact, local authorities generally, many local authorities are further ahead than I would say in my own discipline, nursing, and particularly the work of Professor Donna Hall, who's the current chairman of the Royal Bolton Hospitals Trust, where I was born, and I think looking at new local and their work, and I think we can learn an awful lot from pioneer local authorities. She pioneered the work around the Wigan deal. Also, I think you mentioned briefly, Pam, around, or I think somebody's mentioned about health visiting a practice. If anybody wants to come onto the panel to talk about some of their health creating practices within their profession, that would be great. Health visiting traditionally has involved salutogenic theory and health creation. And then Matthew, you mentioned the Buurtzorg model of Dutch district nursing. And again, I've engaged with Jos de Blok, the founder, and the British and Irish equivalent, to say how health creating self-managed district nursing teams are. We do have fantastic examples that I know of within nursing of health creating practices, which I feel that we need to have explained and shown within the curriculum. Got a lot of questions. I'm going to take a few more questions and then we're going to do a survey. Let me look here. Judy, you're asking, is there any link here into the legacy nurse role pilot created by HEE and due to come into action with effect from April, recruiting experienced nurses in student nurse education and support? That's interesting. Don't know about that. Judy, do you want to come on and talk wider about that? We can give you a place on the panel. There we go. And we just need to unmute. I'm guessing you're transitioning to panel.
There we go. Sorry. So this is new to the STP, and I was planning to retire at the end of March and didn't actually necessarily have a focus for what I wanted to do. And when this email came through, it kind of like seemed too good to be true, because it joined up with my passions about continuing to provide some educational support, etc., etc. The full papers and the full scope of the role is under the CLIP model, so it's collaborative learning in practice. So there should be plenty of opportunities for taking a health creation approach to input to the students, but I won't necessarily be influencing I can't see at this moment I'm going to be influencing sort of the massively wider agenda, but I am going to be making partnerships with local universities. So I'm a fairly good spokesman once I've got well armed. So that's what I'm opening up that idea for, that I'll be having conversations with the local university, which is the UEA, for the area in which I am working, across the East Anglia sort of partnership. I'm a bit limited on the full information of how the role is going to work out, because it's brand new, it's a pilot, so I'm hoping it would go on for longer than a year. I'm going to shut up because I feel like I'm babbling.
Judy, is there anything information that you can send us about your work?
I will do that as soon as I get it, but because they're still going through their process of trying to work out how they're going to, I see Joanna Bosanket's come on the line, and she's a representative. So perhaps if you bring Joanna in, she'll be able, she's going to be speaking from the HEE's perspective.
Okay.
I can see that on the chat, because I'm still waiting for the, having been appointed, I'm still waiting for more information from my to-be employers about how they vision it for the STP.
Welcome, Joanne. You made it. Joanne is the Chief Executive of the Foundation of Nursing Studies. There she is, thumbs up, ready to rock and roll.
Well, apparently I now work for HEE as well, which is superb.
Sorry, I met you at the ACP conference, and you were, I think you were associated with the HEE.
Oh, Judy, you've got an amazing memory. Well done, you. No, I've been gone for about 18 months now. But anyway, that's okay, because it's all good stuff. I think this is a fantastic potential. I've just put in the chat box that my charity is just formulating a memorandum of understanding with the Impact Research Group, which is the person-centered systems transformation research group at UEA, led by Sally Hardy and Carrie Jackson. So all wrapped around human flourishing, healthful cultures, looking at micro, meso, macro level. So I think we need to do some connecting after this meeting today to make sure that everybody's knows about everybody else, really.
Okay, cool. So we can have a look at FutureNurse, I think. Let's see, Laura, if we can. Oh, Michelle, what do you want?
Sorry, I just wanted to add, thanks, Joanne. We've been working with Carrie. When you said impact, it's like, oh, we work with Carrie. So she's been instrumental in helping us with the development of the Percy framework. Can't meet a better academic. She's absolutely passionate about this as well. So, but it'd be really good to make join some more dots as well. So yeah, absolutely. Thanks, Joanne.
Laura, so we don't forget at this point, can we just launch our polls? This is just to take the temperature with the participants that we've got. There we go. How far is your university along in introducing health creation into your undergraduate curriculum? I'll just give you, for those of you who are attached to universities, not all of you are. I can see in the chat that there's talk about there being great variation. Of course there is significant variation in terms of this. Lovely. Do you want to put up the second question then for us, Laura? We just want to gauge where we are. If you're other, you may want to put in the chat. We can't put free text in these questions, we've discovered. So if you are from different disciplines, different sectors, and you're interested in this subject and you want to carry on talking with us about it, then please indicate that in the chat. Lovely. Can you show us the results? Yeah, so we've got 32% of you are not from nursing, so that is just great. And have we got what the results from the first question as well? Oh, that's really interesting. I want to take a photograph. Right, so we are quite a long way along, which begs the question, where are the regulators on this? Lovely. I know those will be saved, Mark and Laura, so do send that to me so we can send it out with this recording. I'm going to take a couple more questions and then we're going to get on to the juicy bit, which is where do we go from here? So Andrew's asking, I would be interested to hear about how we might assess student knowledge and competency. There's been quite a few comments there. Andrew, I don't know if I think you're on now. So let's talk about quality, audit, you know, how do we actually make sure that the experience is a positive one? Go for it.
Well, yeah, I'm hoping other people will have the answer. I so often get asked to just reduce my teaching down to a multiple choice question, and I really don't think that's appropriate for the kind of thing we're doing, but I'd love to hear what others are doing to
Where are you from?
St Andrews University, but formerly of Exeter, so part of the C2 network. And yeah,
I think, do you want to say a little bit? I know we've got C2 colleagues. My mentor Hazel is on. Hi Hazel, I hope I'm doing okay. Mark me later. Do you want to say a little bit? So the University of Exeter has done a huge amount of work, hasn't it, around hallucinogenic theory, health creation, and also complexity theory, because they trained me. Do you want to, and C2, do you want to just explain that?
It's an approach, Hazel will explain it much better than I do, but an approach to kind of improving communities by getting communities to work together. You heard Nigel talk about the TR14ers, which is one of the interventions that came out of this, or one of the groups that came out of this. It all started down in Cornwall. Really, the C2 is an approach to getting communities to listen to each other and bringing the right people in the room and empowering people to take it forward from there. Katrina Wyatt, who I think was online earlier and might have gone by now, was the real kind of lead behind the research, and I was just helping by crunching numbers.
Fabulous. So your question there is around placements experience. Does the panel want to come in on that?
Yeah, certainly there are opportunities, there are barriers around supervision and assessment for practice learning experiences where there isn't a registered NMC, Nursing Midwifery Council registrants, but there are ways around it with the new NMC standards for supervision and assessment that do, you know, talk about they talk about the nominated guide. They talk about, well, you can interpret it as long arm assessments as well, supervision and assessment. So it's thinking very differently about how we support and educate students in practice. And I think Debbie Roberts is online from Liverpool John Moores, and we've just written a book on supervision and assessment. And there's a whole chapter around assessment. There's different techniques for providing that supervision and assessment. And I know certainly across Greater Manchester, I was in a meeting this morning, and we were just dotting the I's and crossing the T's of a policy that looks at more long arm supervisory and assessment processes. So you can be creative, but it certainly can cause issues with the Nursing Midwifery Council, who are more prescriptive with what's required with supervision and assessment than some of the other allied health professionals. But there are ways around it. Certainly we have a HE project that we can share with you how we managed a brilliant student practice learning experience in some amazing forest schools, etc. So happy to share, but you just have to think a little bit differently. Yeah.
Yes, anybody else want to come in on that? Do put your hands up if you want to come on the panel as well, and Laura can can facilitate that. Hazel, you've got your hand up. Do you want to come in? You should just take yourself off mute once you've made the transition. Oh, we've lost her.
It's almost like we're beaming up people, isn't it?
Yeah, that's right. So the thing I want you to put in the chat is your views on whether we need this academic network. Please give us an indication, and if so, who should be on it, and whether it should be undergraduate, postgraduate, or what. Hazel, hey.
Hi everybody. Lovely to be on, Heather. It's super lovely discussion. So I trained as a nurse back in the 60s and got my appetite for health inequalities, and oh gosh, 25 years ago as a health visitor, I discovered a completely new way to bring healing to a community. Actually, I didn't bring the healing, they healed themselves. What I learned alongside my colleagues from housing, the police, from education, fire service, local council, what we actually did, I'm not sure we knew we were doing it, but we trusted that community to heal itself. They knew what they needed to bring healing. We listened to them. They had a leading role. What we did was create the conditions for them to bring healing for themselves. And we've been doing that now, and we've been teaching how you create the conditions for health alongside Exeter University for the last 10 years. But before that, we had 15 years of learning by doing. But believe you me, we learned from the community. So if you came on one of our courses, you would learn from the experts, the communities themselves, but you'd also learn the theory of change from our fantastic academic colleagues in Exeter University. Yeah, I rest my case, but brilliant discussion. I would say, you know, we don't just need this in nurse education. Absolutely, we do. We need it for the police. We need it for the fire service. We need it for architects. I think it's already happening, actually. I think the College of Policing is bringing in. But just think that 80% of what makes us ill lies outside of health. So we all need to be working together, don't we? Yeah, bless you all. I'm delighted to hear it's just wonderful for me to hear the focus on this after so many years of pioneering. So thank you for giving me this chance, Heather.
Do you know, I wouldn't be here if it wasn't for you, mate. Anyway, but thank you so much. Stay on the panel, Hazel, because you're really helpful to us in this debate. I think the feeling of this discussion and the people who've arrived and the disciplines that they're from seems to indicate to me that we need to think wide. Am I right, people? We need to think wider than certainly nursing and health visiting, and we need to think wider into the social determinants of health, wider than the third sector, and right the way through into education, housing, criminal justice, crucially, and into the private sector, as Nigel says, who's a powerful player, religion, parish nurses, and also to think about that just to keep it out as a wide discussion. I'm thinking about undergraduates because of the numbers of them, but I've also heard thoughts about postgraduate education as well. Pam, you had your hand up there.
Yeah, one of my ideas was to try and get groups of students together. So because Liverpool John Moores has got, we've got sports education, we've got social work, we've got nursing, we've got education. If you brought those students together, and then you could link the undergraduates with a postgraduate who could actually manage the team and get them working on projects with communities. And that would be just an amazing model of how we as a civic university like you in Salford could work with our local community to bring something to the community around the university. And what I was thinking as well is that that's great for giving role models to the people from deprived areas, that it's accessible university education is accessible, and then we can also use that as a platform for research in our communities and how we can work with our communities and provide graduates who are actually capable of working in those communities. So I think it could be such an exciting way of working for the future, but it's trying to get everybody on board. I'm quite glad that my new manager's here. If Debbie Roberts is listening, then this is what Liverpool John Moores needs to be doing. So yeah.
Michelle.
Yeah, I agree again, Pamela, and I think it's interesting. So the SIGS bin that we've been working with for the past couple of years has been lobbying the Council of Deans for some time, and I think it's only recently that they had their Council of Deans webinar a couple of weeks ago that I was fortunate enough to chair, which was quite a scary experience, but nonetheless, you know, it started to get on the radar of the people that can make the difference. And I for a long time we've been saying, oh, that the stars are aligning, but I genuinely think that they are now. And I think something like this network could really help promote that and push it forward, because the more of us that are singing about this, the more of us, the louder we get, the more people hear. And you're right, it's wider, it's beyond nursing, isn't it? It's all the different sectors that our society comes from, and it is about that human flourishing, and it is about joining the dots with other universities and the work of Carrie and the impacts and all the research as well. So I completely agree with that. But I do think there is a change, but my glass might be half full rather than half empty on this one.
Lovely. Any other comments there? Okay, I will take this last question about arts because it's very close to my heart. Matt, who wants to talk about the links in terms of interdisciplinary collaboration between health creation and arts. So Matt, if you're still with us, do come onto the panel and we can talk about that. Go for it. I'm currently doing Singing for Lung Health, by the way, if you're interested.
All right, so I wasn't looking to say anything, I was looking to hear something.
Yeah.
Wondering what you guys think about arts and health. I mean, yeah, Singing for Health, fantastic. Drama work that I do, we do a lot of applied drama and health, particularly with nursing students and now nursing practitioners in the trusts in Northern Ireland. Just starting that now. Particularly, we found person-centered nursing and the concept of sympathetic presence was something that people thought was a vague, general category of, you know, you should pay attention, you should be nice to people. But we found that we can use very specific techniques from actor training that make that, one, a much more understandable concept, and two, something you can actually practice as a skill and get better at. But in the broader field, in terms of the APPG report from 2017, on arts and health participation, and the recent World Health Organization report on arts and health, there seems to be pretty strong evidence-based mounting that, you know, one of the most effective ways of health creation and preventing people having to go into hospital is widespread arts participation. So on one hand, there's the stuff that I do with the nurses, which is improving their communication skills, and there's quite a bit of evidence that improves the resilience as well, which is handy these days. But also in the broader community and population, things like being in a choir or a drama group or a multidisciplinary arts project. I'm particularly thinking of like Mike White's work about places like Bromley by Bow Medical Centre, which is also a community arts centre. That kind of stuff. I would think that would be a really strong area for interdisciplinary research, practice and teaching. Although I find my end, maybe it's just because I'm in Derry, it's a really lonely furrow to plough, and obstacle after obstacle after obstacle is presented, particularly within the academic sector, by certain schools and faculties.
That's fabulous. I can see Hazel vibrating next to you.
Goodness me, absolutely, 100%, Matt. You know, gosh, we've got a network across the country now of health creating communities, and they quietly get on with it. And honestly, the sky's the limit with what those guys do with the arts. It's just phenomenal. You know, dancing, drama, it's just terrific. Yeah, fantastic. Couldn't agree more.
Yeah, fabulous. I mean, the evidence base is there, really, isn't it? In terms of what happens within the endocrine system. I've written about it around singing. I think it's a hearts and minds thing again, as we've mentioned before. Anybody else want to come in on arts and health? It's very closely linked to Michelle's work, I know, around green spaces and green therapy and that sort of thing too. Yeah. Or prompting her now, she's going to.
That's the, yeah, sorry, you've mentioned nature-based stuff. No, I completely agree, and it is about changing hearts and minds. And as Jackie mentioned earlier, the Health Education England project that we ran, piloted last year, we sent a couple of our student nurses out and they went into a forest school, and they really did truly learn to engage with kids from a really quite bad social environment, how to engage with the parents through nature, through talking and walking out in the woods where they weren't confined to a classroom, and all the creative stuff that they did, like building little stick men and pictures and leaf mold, all of that. You know, it's just one tiny example of a really strong evidence base that's out there. You certainly were pushing an open door here, Matt, in terms of that. But I know that I don't speak for all academics, but you know, this is about turning the tide, isn't it, and understanding the impact of that. You know, we can't sing it enough. And there is an awful lot of work in Salford. My colleague Gaynor Bagnall's working with museums, looking at how we develop and create health opportunities there. There's a whole load of work, certainly within the northern universities, and I know because people have been coming in contact saying we've got this artist that's going into the students' curriculum. They're talking about how to use art to promote X, Y, and Z, and so it does go on, but it's not consistent, and there does need to be a more consistent applied approach across all the academics as well. So yeah.
Okay, Pam? Just briefly, and then I want to do.
Yeah, I think there's so much. When you've got a huge university where you've got things like teachers in training, and then next to that, you've got undergraduates who are struggling with their academic work. And then you've got student nurses who are learning about mental health, and you've got students who are struggling with their mental health. And yet we're not connecting the dots, and we're not using the resources within the university, let alone using the resources that we've got within the university and the community that surrounds the university. So maybe what we need to do is to start by in-house using things like drama with mental health nurses and adult nurses, and then rolling that out as a program whereby we can work together at really cross faculty.
Can I just say, I agree with that, Pamela, and for me, when we've been working on the Percy framework, we all have lots of ideas, and we could actually talk for England about the ideas, and then we come away and actually we've not put anything into practice. So actually we're under the mindset now that actually you can't change the system in one big chunk, but what we can do is that work with those people who want to do something. So it's about it's about engaging with the right stakeholders, and if they're the people who actually want to engage with us, then let's work with them. And I almost think that, you know, why can't we use the service improvement methodologies that they're using in healthcare and actually have our own educational methodology? Why can't we have a small test of change? You know, sometimes we're quite risk averse because we have to go through all sorts of systems just to change something in a university, but I think we just need to think a little bit differently and be a little bit brave. And for us, it's about leadership. So, you know, you can think, I like Kuzler and Posner's 5 exemplary leadership. You know, it is being courageous and being brave and doing something, and, you know, finding the people who will go with us. And if it doesn't work, it doesn't work. But if it does, you know, we can change mindset. So I think sometimes it's running with something small and tangible and letting it grow.
Well, marvellous. We're getting up to time. God, that went quick, didn't it? This was almost as bad as running a tweet chat in terms of looking at the chat, looking at the questions, looking at you, making sure what comes out is right, or at least legible, or whatever the word is. So in this last moment, what I'd like to do is for you to use your raise hands function. So just find that in terms that we do have a raise hands function, don't we, in this? What I'd like you to do is to put your hands up if you think, yeah, we should have an academic network. We should definitely, we've got something here, we definitely should do it. So let's have a little look at that. Okay. All right then, if you can lower your hands, I don't know whether you can do that. Oh, yeah, marvelous. And the next question is, let's have a little straw poll about you'd like to continue this idea and you want to be part of such a network from whatever background you are. You don't have to be an academic to do that. Okay, I think that's fairly categorical. Then you do. And then what we do need to think about is how to resource that. If you've got, you've all got my email address now, because I've sent you multiple emails by now. heather.henry@brightnessmanagement.org.uk. It's in your emails. It's on the Eventbrite page. You can't get rid of me now. I'm your mate. How to think about how we might resource that. As Jackie said, the University of Salford, who I'm an honorary fellow with, senior researcher with, senior lecturer with, has indicated that they would be happy to host the network, whether that's alone or with partners such as the Foundation of Nursing Studies. We can talk about that. So we do need your ideas about resourcing that. So if you have any ideas, please do stick it in the chat or write to me. And then we need to think about sort of early wins. And I can see that in the chat, there are a number of useful resources that have been shared so far. And what I would like to do as an early win is for, again, either put in the chat or email me with any useful resources that would be useful for either pre-reg, post-reg. There's a lot of talk about, yeah, I think it needs to be everything. We might have to talk about that, but send us your resources so that you will get a recording from this event, and you will also get those early, that early win. Hazel always talks about that. Make sure something happens around sharing of knowledge and resources. Okay. We will get back to you very soon and talk about what we're going to do next. I think for us that have been planning this, we're going to do a debrief and we'll keep in contact with you. The sort of themes that I'm getting out from this has been that we should be bold, we should be ambitious, and we've got a few disruptors in this group, so that's always good. And we should align this idea with wider initiatives outside of healthcare that may be going on, and some of those have been discussed. And that there may be a number, in terms of persuading our universities and our regulators, there are a number of positive benefits, I think, that we could use to persuade people. Now I'm going to leave it there because we're 5 minutes over time. Thank you for that comment, Ian. I just read that. Thank you for that. We're a little bit over time. So I'm going to thank my panelists. Thank you ever so much. Thank those people who've been encouraged to speak. That's been great too. And thanks to Mark and Laura at Salus for hosting us. And we've gone 5 minutes over. So I hope you'll forgive me for that. And I'll speak to you very soon.
Thanks,
Bye.
Heather. Thanks for organising a great meeting. Bye, everyone.
Bye, everyone.